A recent study has uncovered a concerning trend for patients with end-stage kidney disease who develop gout while awaiting a life-saving kidney transplant. The findings suggest that gout significantly impacts their chances of receiving a transplant and increases the risk of death during the wait. Dr. Sandesh Porajuli and colleagues from the University of Wisconsin-Madison analyzed data from over 34,000 adults on the transplant waitlist, or insured by Medicare. The study period spanned from 2016 to 2019, with health records tracked monthly through December 2021. Using sophisticated statistical models, the researchers assessed the impact of gout on the likelihood of receiving a deceased donor kidney transplant, DDKT, and mortality. They adjusted for various confounding factors, including hospitalizations and cardiovascular comorbidities. The results, which will be presented at the 2025 American Society of Nephrology Kidney Week, paint a worrying picture. Patients with gout had a higher risk of dying while on the waitlist and were less likely to receive a transplant compared to those without gout. During a median follow-up of 2.7 years, nearly 5,000 patients developed gout after being added to the waitlist. These patients tended to be older, predominantly male, and had higher rates of hypertension and coronary artery disease. The study observed over 8,000 deaths and more than 11,000 successful DDKTs during the study period. IPW-weighted analyses revealed a 23% higher hazard for waitlist mortality among patients with gout and an 11% lower likelihood of receiving a transplant. The disparities in outcomes were evident at 1, 3, and 5 years. Mortality rates were consistently higher for patients with gout compared to those without it, 8.6% versus 6.5%, 31.6% versus 24.4%, and 51.6% versus 41.5%, respectively. Similarly, fewer patients with gout received a transplant during these periods, 16.1% versus 14.5%, 34.1% versus 31.1%, and 45% versus 42.5%, respectively. Dr. Porajuli emphasized the need for targeted gout prevention strategies and clinician awareness to improve patient outcomes and access to transplants. This study highlights the complex interplay between kidney disease, gout, and transplant outcomes, and the importance of addressing these issues to save lives. But here's where it gets controversial. What if we could prevent gout altogether? Could this be a game-changer for kidney disease patients? And this is the part most people miss. The impact of gout extends beyond physical health, affecting patients' mental well-being and quality of life. So, what do you think? Is gout prevention the key to improving transplant outcomes? Share your thoughts in the comments.